So today's guest speaker is from Andhra Pradesh. So Madam is an associate professor and HOD Department of Postgraduate Studies of Prasuti Tantra and Stri Roga. And we will be starting with few medical high-risk pregnancies or Garbini, not a normal one. So the topic for today is a very interesting topic. So I request Madam to come on screen and share the topic.
Namaste. Thank you, Dr. Shreyas. Yes, I congratulate you all for the first session of webinar, Gnana Vignas of Karnataka. I also watched all those webinars that time. So I felt very happy, and I'm very happy to share my knowledge now in the second session as a first speaker about Bahwapatyata. So, being part of this session, I am Dr. Kola VijayaKumari, HOD of Prasuti Tantra Stri Roga Department of UG PG, Dr. NRS Government Ayurvedic College, Vijayawada, Andhra Pradesh. So, here I like to insist. The first session has been mentioned about the normals of female reproductive system. We have to deal about the normal anatomy and physiology, which can deal with a healthy reproductive system. Why we have to think about healthy always? We have to think about the always healthy situations for the progeny. So when we have the progeny of every family as in healthy manner, the nation also happy with the healthy progeny and the next repeated population rate. So here, every pregnant mother is given an important situation or circumstances by the government of India and the local governments of the particular states according to their phenomena or circumstances. Here today I like to discuss about Bahwapatyata. So here I am sharing the screen about Bahwapatyata. So the importance of Bahwapatyata. Here Bahuapatyata. Here Bahuapatyata. So Bahuapatyata means Bahwapatyata here. Bahuapatyata means many children. Many children or many people are traveling or coming from that way. That is the Bahuapatyata. So more than one child, more than one fetus is coming through the vaginal route can be taken as Bahwapatyata, and that is also can be termed as Yamalagarbha, or that can be termed as multiple pregnancies in modern sciences. So we know the incidences of multiple pregnancies. So commonly the Bahwapatyata or multiple pregnancy can be given importance as that. So today in the highlights, what I have to share is Bahwapatyata or multiple pregnancy here, what our Ayurvedic classes were mentioned. So those were mentioned in our Charaka Samhita and Sushruta Samhita in the early days of 2000 years back. So what they have mentioned in Sushruta means Vijaya Antarvaina Binna Gojuva Kukshimagata Yama Vityabhidiyate Dharmatara Purasaro. So what it is saying that? So Vijaya Antarvaina. So the seeds. What are the seeds means? The fertilized egg. The fertilization has been over, and the fertilization of the fertilization of the ovum is over. It has been turned to the zygote, and that can be called as fertilized egg. So during that time, the vata or vayu can be entered into that fertilized egg that can make divisions of that particular. So how many divisions that can be happened in that kukshi, that can be given that much of jivayu so that it gets its own individual life. So multiple fetuses that we can see. Apart from usually we think about single fetus in a normal antenatal. So but here we were discussing about multiple fetuses. So the importance here we have to adopt or give to secure the pregnancy, to secure the pregnant woman's health, and their progeny. So, and the Charaka Sharira also has been mentioned as this same. Vinantiyavat Bahupradanaha, Sukratavam Vayurati Prabhudaha. So, because of the speed of Shukra and Artava, the Vayu has been little bit accelerated more, and it divided the Shukra and Artava into pieces, and that pieces acquired life and got into an individual person, that is multiple fetuses where we can see. So this is about the Bahwapatyata of the multiple. The same thing was accepted here. The same thing was accepted by this Acharya Harita and many of Acharyas like Vagbhata, Bela. Everyone accepted that it has been accepted because of Vayu. The division has been occurred and it can be given fetuses rather than fetus. And what we have to think about this, the psychosomatic factors of the couple during not only this Sukrartava. One more thing we have to accept usually is when the couple comes to us, the psychosomatic factors during the sexual life influences the doshas. It results into twin pregnancy, or that can become a triplet or a quadruplet, or it can have, and this may have the similarity between twins, or they may be dissimilar as the twins apart from this. And these are so many when the factors are influencing the determination of the sex. So when we were studying about this Ayurvedic classics, while what is the importance of formation of gender while the fetus forming its own gender. Whatever Ayurvedic classics mention is during intercourse, if there is more amounts of Shukra, that can give male baby, and if it gives more amount of participation of more Artava, that can be given as the female baby. Here also, even in Bahwapatyata also, you can see that what our classics has been said in the terms of Amalagarbha or Bahwapatyata is when there is more Shukra and they have more male babies. When there is more Artava, there we can see the female babies. So this is what we have to think about. And multiple pregnancies are common now in these days today's. Why? Because you can see around the globe, or the US Department of Health Human Services, they are saying that they have increased multiple pregnancies rather than 1980s or 1990s, about 75%. Why? Because the influence of iatrogenics. So what is the iatrogenics means? What we can have is the people, those who are coming for infertility treatment. Usually they are coming for infertility treatment. What the gynecologists are doing is they are giving medicines for induction of ovulation. Because of the induction of ovulation, definitely there is more than one ovum can be luteinized. So that luteinized more than one ovum can be seen as the multiple pregnancies. So that is incidental hike of the twin pregnancies. Hello. So here I like to insist, what are the types of multiple pregnancies? So all of us know as the dizygotic multiple pregnancy or the monozygotic multiple pregnancy. What is the knowing of dizygotic and monozygotic twin pregnancies? Being a postgraduate doctor, because already we all are doctors as undergraduates, and we have been further given importance to study more about post-radiation. So what we have to differentiate while studying the textbooks or the papers or the clinical assessment. It is monozygotic, maybe the identical twins, dizygotic, they may be the fraternal twins. This is very commonly we can say they will have a same, the identical twins may have the same gender, and the fraternal twins may have the different gender. They can have both male and female babies at the same time. But here, being an obstetrician, what we have to do? So this knowing the type of multiple pregnancy is a greatness to an obstetrician. How and why means, so we can explain the people, the antenatal women, or those who are coming to your regular clinic for checkup, you can advise that you are carrying more than one pregnancy, because the woman may be shocked, or the woman may be scared, or she may be frightened, or the family people may be frightened because they expect pregnancy, but here she is getting more than one pregnancy, so they may be frightened. So this frightening, we can counsel her as a pre delivery. So we can counsel her. So what type of counseling we can give her means, the fears whatever she have while carrying the pregnancy, given care. So you can explain as an obstetrician to your pregnant woman while she is coming into the antenatal checkups. So what we can explain everything means here, the things you can have. So dear, when the pregnant woman comes, when usually I say my students or anyone, when an antenatal woman comes to our OP, I never say them, I never ask them as a patient. Even I ask every person or every doctor, those who are getting training from me, I said that don't call them as patients, because they were not the patients. Just it is a physiological phenomena. Pregnancy is a physiological phenomena, and they have to get their own physiological process of a delivery. So here, what we have to say means that pregnant women, we have to mention, yes, you have to follow. You have to follow the instructions. So here, you are getting pregnancy more than one fetus. So you should be so cautious, because they may have the first trimester complications as more hyperemesis gravidarum, nausea or vomiting, or she may have height of the fundus is more than the period of amenorrhea. This all we may observe, and she also may complain that, doctor, I had my LNP of only 2 or 3 months, but I'm seeing my belly is grown up to the size of 5 months amenorrhea. I'm scared what's happening to me. So that time we can counsel them, we can advise them, we can make assure that nothing to worry about your belly, that you are carrying more than one fetus, so that you can have your beautiful two babies into your lap in upcoming days, so that we can explain to that lady. So before saying those happy words, and while saying those happy words, one more thing we can say is that if she is carrying monozygotic twins, we can advise her, we can explain her what is called monozygotic twins. So they may share as monoamniotic and monochorionic. So this is the complication where we may see this IUGR babies, or sometimes we may see that vanishing twins, or sometimes we may see that one fetus was compressed and the another fetus may become normal. So this all we can explain while we have been observed. Now in these days, diagnosis made easy for us. Just we can depend upon the investigations. So we can explain during monozygotic twins, you may have an IUGR baby, so that you have to get a good nourishment to develop your both twins in your womb. So that we have to assurance we can give her, and we can prepare them for further management and for the delivery also. If sometimes the monozygotic twins may have inconvenience of transverse lie and one vertex, or they may have a differentiation or malpresentations in their presentation, everything we can explain. So this is lesser. The dizygotics have lesser complications than the monozygotic. So this we can explain. And not only that, we were seeing so many Siamese twins. So usually, being a doctor for that woman, while you are having antenatal checkups, we have to follow, we have to observe. If there is division or the formation of multiple pregnancies or twin pregnancies, after 3 days, you can expect this monochorionic and diamniotic. And if it is happened from 4th day to 7th day after fertilization, you can say as the monochorionic and monoamniotic. And if you see this after formation as the after 7th day of formation as a twin pregnancies, you can see the chance of Siamese twins. So this is for our knowledge. We have to learn. We have to get secure of that. So we can have a knowledge about multiple pregnancy, how they were formed, how they were getting into their life to be happy or to may harm them or hurt them during their conditions of the pregnancy. So this all we can learn about the types. Simply reading identical or fraternal is not the criteria. Being a postgraduate doctor and an obstetrician, so we have a thorough knowledge. That is essential. That's why we were all discussing in our webinars all. So you must have the knowing of this types of formation of the types of multiple pregnancy. And next, what are the types of presentation? This is very essential for a doctor. For an obstetrician, this point and this diagram is very, very essential. You see, here I am showing a diagrams of that. One vertex presentation, one breech presentation. So this is safe so that we can go for a normal delivery. And there is one both breech presentations that we can go for a normal delivery, and both vertex presentations, both we can go for a normal delivery. But the rest of the two, where we have one breech presentation with one oblique line and one vertex presentation along with one transverse line, or this transverse line or oblique line may have an influence of making complications during labor. So that we have to get thorough knowledge. So that we have to get the thorough knowledge about this types of presentation. The types of presentations where we have to see here. So where a clinician or an obstetrician must have thorough knowledge during palpitation. Not only the palpating, the height of the fundus or height of the uterus. So this is examination abdominal. So while we were examining abdominal examination, sometimes, now in this just what we think is no problem. We can have scanning. We can send every pregnant woman for an ultrasonography. That may not make no disturbance or no problem to her, so that we can explain. Sometimes you may be devoid of ultrasounds. So you may be at the remote areas, or you may be lack of investigations. During that time, we have to depend. Every obstetrician by themselves have to depend upon their own knowledge while palpation. That what we read under the chapter of fetus in utero. So here you have to check that where there is multiple fetal parts are palpated, or there you can see height of the fundus is more than the period of amenorrhea, or you can found the multiple fetal heart sounds, then you can say that there may be a chance of multiple pregnancy. And apart from that, of course, we go for the ultrasound abdomen to diagnose the multiple pregnancy. So I advise every postgraduate scholar or upcoming obstetricians of our Ayurveda. We have all the system of Ayurveda earlier. It was mentioned in Sutriya. So that we have to mention the Sutriya, and apart from that, we have to live daily up to date. So for that, we have to acknowledge and we have to learn what we have to implement upon our patients for a safe delivery and safe child after the delivery. So this all you have to maintain. First, for that, you know the types of different presentations, and apart from that, sometimes you may see the cord prolapse, sometimes you may see the placenta previa, or sometimes because of the growing two fetuses in a womb, so there may be a chance of abruptio placenta. This all we will discuss under complications. Okay, then next, what are the risk factors for multiple pregnancy? This we must be very aware, because so naturally no pregnancy will be a hazard. That's why it is called the physiological phenomena. And if it is a hazard, then definitely we can go in to take care of them and not to have any harm or sickness. So naturally the twins occur about 1 in 250 pregnancies, and around 10,000, around we can have triplets in 1 in 10,000 pregnancies, and quadruplets about 5 to 7 lakh people, 7 lakh people in 7 lakh pregnancies. So this is the ratio. We can see the twins, triplets, and quadruplets as the multiple pregnancies. That is the Bahwapatyata, more than Bahwapatyata. And I think I can say one word. We know the people Bahwapatyata of 101 pregnancy in our Indian mythology. So you know everyone. Yes, I don't want to say that word to you people. Someone may like, someone may not like, or someone may accept, or someone may not accept. That I'm not going to say. But I always insist my students that we are seeing 101 deliveries at a single in our Indian mythology. So, like that, we can see that one twin pregnancy, 1 in 250 pregnancies, and one triplet, 10,000 pregnancies, and about one triplet, one quadruplet, about in more than 7 lakh pregnancies. So, this is where we can see. And what are the main factors that increases the chance of living is in multiple pregnancies? There, first we can see why it is happening. Why it is happening as twin pregnancy or triplets or quadruplets because of this infertility treatment. And apart from that, we have there is a place in Kerala where I heard that just it was not in my mind suddenly. So there is one place in Kerala. There is a village. So there we see every people were getting twin pregnancies, and some people like to go there for only the sake of twin pregnancies. Maybe that is our Ayurveda says that we our life will depend upon the Desha Kala Paristhiti. So that may be the Desha and Kala of that particular area, so that there they'll get the multiple pregnancies. It's their fortune or the places. And what are the factors which are favor for multiple pregnancies? So here, what are the factors here we can say about the multiple pregnancies means first we go through the race. So usually Negroes are very prone. Negroes are very prone for multiple pregnancies. So they may have 1 in 80 pregnancies may become as a multiple pregnancy. And when we go for Caucasians, it is moderate. When you go for Mongolites, it is very less compared to the African, the Mongolites or the Negroes or the Nigerians. So this is how the Caucasians and the Indians we can see 1 in 250 pregnancy maybe of multiple pregnancy. And coming to the hereditary, yes, it is hereditary. Usually it is hereditary because of maternal side. So while we were taking case history, while we are asking that woman for the case, when they comes to us for antenatal checkup, we'll ask that what are the histories that your family having during delivery. Some people say, doctor, we have a continuous multiple pregnancies in our entire, I myself and my sister and my aunt and everything like that, they'll complain. So this comes, usually there is more chance from maternal side in the hereditary factor. And you can go for the maternal age, and it is prior pregnancy history. So what is the maternal age means? If it is elderly primary gravida, so more than 30 years of age or 35 years of age, definitely there may be a chance of multiple pregnancies, maybe because of natural or maybe because of the induction of the ovulation. So this is very common. And after that, you can go for the pregnancy. So if she is grand multipara, so she is grand multipara, usually fifth gravida and onwards, definitely they'll have the chance of multiparity. Yes, I observed these cases. I have in my practice, just I have seen more than 5-6 women. Those who have been to the fifth gravida, they have this multiple pregnancies. So here where we can have the chance of multiple pregnancies while increasing the parity more than fifth parity. And not only that, hereditary, it is a genetical. So first that thing we have to recommend them. We have to advise them. It is their genetical factor. They may be scared because of that. So it is genetic. It is not only the elderly primary gravida, the girl or the woman after 18, she may be conceived and she got this multiple pregnancy. So definitely she may have multiple pregnancies. She may be scared. Doctor, I'm not 30, I'm not 25, just I'm 18. I had twin pregnancy. Is it good for me? Then you can say it's nothing to worry. It is your genetic factor. So no problem. You have your maternal aspect. And so that it's nothing to worry and no harm to you. And definitely you will have a good progeny and you will have your better children in your lab. So that we can advise them. And coming to this fertility drugs like clomiphene citrate and this letrozole, like all the drugs which are giving the more ovulation. So for that we can read in the chapter of in the multiple pregnancies, where we can see the superfetation, superfecundation. So what is superfetation and superfecundation? They'll say means there is formation of fertilization, or fertilization can occur with the two ova in different forks of the intercourse, and there is the formation of fertilization in different cycles of the LNP. So this we can deal under the fertilization of the drugs. We can be seen in the terms of this drugs and all. Okay, so this we can say, this we can see in the terms of so and what is the duration of multiple pregnancies? So the duration of multiple pregnancies where we can have is this: the duration of a normal singleton pregnancy may be of 37 weeks to 42 weeks. Here the multiple pregnancy also same, because the natural time or the normal time to bear pregnancy is 37 weeks to 42 weeks. If there is any delivery before 37 weeks, it is called preterm delivery. If it is any delivery after 42 weeks, it is called postterm delivery. So it may be a multiple pregnancy, it may be a singleton pregnancy. Each have to wait for 37 weeks. So this is normal, and they'll wait for 40 weeks and they give birth to healthy babies. So this is the duration of multiple pregnancies, unless until if they have any abnormalities, then there may be a decreased chance of getting delivery before 36 weeks, from 32 to 35 weeks. So as far as I concerned, I observed so many deliveries. What our Ayurveda says is exactly maintenance of Voja, Sanchaya, is true. I have been seen so many women, those who have delivered during 8-month pregnancy, so they will have this Voja Sanchaya, and sometimes there may be a loss of fetus, sometimes there may be a loss of mother, sometimes there may be a loss of both mother and fetus. This is my observation. What I trust our Ayurveda has been proven in my observation. So that's why I'm insisting. So what I'm insisting is, you please take care of your woman that comes for you as an obstetrical leave for antenatal checkup. That is our prime responsibility, to secure their pregnancy for healthy progeny. So duration of multiple pregnancies, you have to monitor regularly and you have to go for. And these are the some episodes there, the type of pregnancy where you can have the singleton pregnancy. Will have about 3.3 gram kg weight when it was delivered 38.6 weeks. And there is twin pregnancies when they have 35 weeks of fetal life, and they weigh about 2.3 grams, 3 kgs each. And the triplets, they are weighing about 32 weeks, because they may weigh about 1.6 kg, and quadruplets about 30 weeks, and they may weigh about 1.3 grams. Now in these days, we are made easy for surviving as neonate in NICU units, even though they were less than kg weight, because of the developed modern technology with the modern medicines and modern science. So it is not any abnormal, but only thing we have to see is not to have any infections, and not to have any harms, and not to have any shoka krodha. So these all are bhaya, shoka, krodha. So these all are garbhopagatkara bhavas. So we have to take care of that woman, not to go for garbhopagatakara bhavas, so that she can damage her pregnancy, so that she can damage herself, so that she can damage her family, both maternal side and husband side, and this all may go into a sorrowful situation. So this is better to have regular checkups. Okay, and usually what are the complications we have to go for? Because why I insist complications rather than management prior. So why? Because we have to go for complications in multiple pregnancies, because so we should learn what were the complications, how we can rescue them. So this is an idea of doing examination and doing everything. So what we have to go for a complications here, we can have means So here the complications, first I go for during pregnancy. During pregnancy, what are the complications during pregnancy? So because of weighing more, she increases her weight. She increases her weight because of more weight. So she's scared. Usually the pregnancy will have 2 kg gain weight, singleton pregnancy. If it is more than single pregnancy, if it is 2 pregnancies or 3 pregnancies, obviously she will increase in size. That increasing in her weight may lead her into panic. So that we have to advise. And increased fetal circulation. There are increased feto-placental circulation more than singleton fetal circulation. So there may be the plasma may be weakened or plasma may be diluted. So around 500 ml about the plasma may be like a dilution, and you can have a diluted blood flow and the fetal circulation. Hello, please, some of you, please, can you unmute your audio, sir? Sir, mute, please mute your audio, sir. It's making Dr. Shreyas. Hello?
Yes. Rectified, ma'am, rectified.
Yeah, thank you. Okay, so here we have to go for this the discussion. While what we have to say means here, once we were confirmed that it is a multiple pregnancy, we have to give an priority during pregnancy, during labor, during postpartum, and as a fetal and newborn complications. So during pregnancy, what we have to go to, and during labor, everything that I discuss in the management. So apart from that, what are the diseases during pregnancy we can expect means because of the load, she may goes into hypertension. Because of the load, she may goes into edema. And because of that, she may have increased tidal volume, fetal tidal volume and the fetal glomerular filtration. And herself also, she may go into some renal impairment so that she may lead into proteinuria. So all of us know what is called eclampsia and what is called preeclamptic toxemia, and that we read under the chapter of hypertensive disorders in pregnancy. So any of 2 of the triad might be the hypertension or edema or proteinuria. Any of the 2 of this triad is present in that particular woman, we have to be given care for her to keep her in a preeclamptic ward. So that we have to give an priority so that why she had this is. And not only that, you have to give care for her hypertension, to reduce hypertension, to be maintain her normal blood pressure, and to maintain that she should not have any pathological edema because of nutrition, because of some other diseases like renal impairments, and diabetes mellitus she may have because of the increased circulation. She may be in tension and maybe of the stress, so that she may go into diabetes mellitus. And sometimes they may have their common metabolic disorders like their family history may have this diabetes and all. We can suspect them by monitoring regularly. And not only that, the woman may have epilepsy or she may be of scared. So this all you have to given priority while you are checking. And during labor, so the during labor that I discussed in management in the postmortem and all, we go for. So first we can prevent multiple pregnancy. How we can prevent multiple pregnancy? These all are God. Pregnancy is a God-given gift. So how we can prevent means, so in natural, we may not prevent. If it is happening naturally, we may not prevent. Or if we were doing for IVF or any transmissions or any infertility treatments, definitely we can have a chance of getting lower the conceptional, the fertilized eggs. So this we can have, and more than 3 follicles is helpful in reducing a high order multiple. So this is possible in the IVFs in the laboratory of embryology. And after that, we can have this multi-fetal pregnancy reduction. So these all in chambered places where we can have a multi-fetal pregnancy reductions can be considered as the improving chance of other fetuses rather than more fetuses. Okay. So how we can have caring the multiple pregnancy? So the caring the multiple pregnancy here, the caring multiple pregnancy is that regular metabolic and nutritional considerations. The metabolic and nutritional considerations, activity precautions, monitoring of multiple pregnancies, and method of delivery. So everywhere, whenever we were studying about care, should be of antenatal care. That is very essential. And one more thing why we have to discuss about the psychosocial effects in multiple pregnancies on a family study. Sorry, I didn't got the multiple pregnancies. So how it affects? So already I spoken that they may be bhaya, krodha, shoka, and with that she may be weaned. And the parents, the girl may be of 18-year or 20-year-old girl, and she may be lean. Now she is carrying heavy belly. So mother may be scared. Ayo, how my daughter will deliver? Ayo, what happens to this girl? Like that, they may be scared, and they scare and they frighten that girl. So she may be bright, or she may be intelligent, or she may be very strong, but the people surrounding may skip them or may make them into some disturbances. So this all we have to go for. And one thing we have to advise them in the psychosocial effects of multiple pregnancies on a family is the majority of the women with a multiple pregnancy do very well. Their families may experience significant stress. If prolonged hospitalization is needed, arrangement must made, and we can advise that lady work from home or work from. And you have to advise everyone for the family care. So psychological question we have to go for. So finally, I go for the management. So what is the management? I already said the management. So here, the talent or the skill of an obstetrician comes out. What is our aim? What is our object? So the aim and object of every obstetrician is given importance for a safe labor room with a safe neonatal ward. For that, we need a safe antenatal checkup. So all of us know that we have to keep these pregnancies under no risk, low risk, high risk. Here, the multiple pregnancy can be given under high risk group. And she have to be given for regular antenatal checkups. And she is asked for investigations regularly. So what we have to view in regular antenatal checkups? So we have to view the regular antenatal checkups for routine as blood pressure, the monitoring of the blood pressure and proteinuria, or increase in weight and the growing of abdomen, everything we have to see. And one thing we have to go for is always when that woman comes to our OP, you have to advise that you are a pregnant woman. Don't become a pregnant patient. That is our assurance. I'm not going to see you as a patient. Just I want to see you as a pregnant woman and after a mother. So this is my object towards you. So please be cooperate and do follow what the instructions we are giving to you, because you are weighing multiple pregnancies. For that, usually we have to ask every pregnant woman once in fortnight, once in 4 weeks for every 28 weeks. But here, the multiple pregnancy people can be given in a high risk group, and she is advised to come to the hospital once in 15 days till the 28 weeks. And from 28 weeks to 32 weeks, she is advised to come once in a week. And after 32 weeks, she is advised to be hospitalized or come regularly once in 4 days. Or if she stays far from the hospital, you have to advise that lady, please be stay nearer to the hospital, so that if any inconvenience happens to you, you can come to the hospital. So this is how. And during antenatal checkups, what we have to see regularly, we have to, every obstetrician have to maintain the blood pressure. That is an essential thing. And go for checking of the edema and check the loss of any albumin in the urine, that we have to check out. And monitor weight, whether she has gain of 2.5 kg to 3 kg, gain of the weight from last visit to this visit for 4 weeks, or at least 1.5 kg for every 15 days, that we have to monitor regularly. So this all. We have to advise that women, definitely you are having a good babies. You are going good babies. Your babies are growing good. So that all you have to alert her. And after that, you have to maintain her regular antenatal checkups as that the regimen of the checkups. And after that, you have to go for investigations. So every obstetrician, don't hesitate to go for investigation, because this is our prior idea. This is our prior idea to mention every woman to have secure for investigations. That starts from her monitoring of blood pressure, maintenance of urine investigations. Not she's not having any loss of albumin and phosphates, and she should not have any urinary infection as pus cells or any epithelial cells as a complete urine examination. And after that, she have to be screened for all viral marks, whether she have any history of viral marks in terms of HIV, VDRL, HBsAg, HCV, that may take her into abdominal delivery, so that we can suggest her by knowing HBsAg and all. There are some viral diseases where we cannot go for normal vaginal delivery, so that we can advise her that here we are going to advise you the abdominal delivery because of this. So we don't want to contaminate your baby with this viral marks through your vaginal route. So it is better to you to have abdominal route for no contamination of this viral disease to your baby. So this is how we have to explain. And not only that, we can check for the essential, most essential, the very essential needy thing is knowing the blood group along with the RH typing. So this is very essential. This every doctor have to made in the first visit of that woman. So she should have the regular monitoring of blood group along with typing. And it is better to have monitoring of the clotting time and bleeding time if it goes into an emergency during the delivery. So this is how we have to go for all investigations apart from the scanning gravid uterus. So this is how. And sometimes the woman may ask for this amniocentesis. So that also can go for that to rule out, is there any diseases coming from chromosomal abnormality like Turner's or Down syndrome, so that they can terminate their pregnancy if the children, if the upcoming children become very sick. So this also we can help them. So these are the prior investigations to every woman she can. And not only thing, one more thing we have to advise, you rule out for sensitivity of the drugs. Sometimes they may be sensitive for some diseases, some chemicals. So I know so many people, so they are sensitive for simple lignocaine. I know them. So what we have to do in emergency table, they are sensitive for the xylocaine groups. What the surgery we have to do with anesthesia. So this is how it is better to know them. They are sensitive to any drug. This you have to go for in terms of investigations only. And you have to advise diet and exercises. We have a very good topics the coming up as in the Garbhini Paricharya, what Shreyas has made through Jignas, Gnana Jignas. So what Garbhini Paricharya we have according to our Ayurvedic classics, they have mentioned very clear. She have to take the foods which are essential for her. Apart from that, she have to go for Masanumasika Paricharya as Garbhini. In first month, she have to go for the rice gruel with ghee. And after that, she have to add rice gruel milk with ghee. And after that, she have to add milk gruel along with navaneet. So like that we have. And from 4th month and 5th month onwards, she have to be given mamsarasa so that the fetus will get its protein structure, the formation. That's why during 3rd month, it is all in the rudimentary forms. So when it comes to the 5th month, definitely it becomes all soft. And Panchame Buddhi Shashtamaha, this all we can see. So now in this days, you see in singleton pregnancies or in multiple pregnancies, where there is a preterm delivery, the fetus is weighing about less than 1 kg, also surviving in NICU units, because they have every formation of the body. As the 5th month enters, they complete their all Hastapada Nitamba, everything in a full form. And not only that, they acquired buddhi, they acquired mana. So what is fertilization? Shukra Shonita Samyogetu Jiva Kala. So only it was entered by Shukra Shonita along with Atma. And Panchama, it has been Panchama and Shashta, it has been entered buddhi and mana. That means that fetus, when it comes to the earth, definitely he had facts to survive as a normal entity or a normal person. So this our Ayurvedic classics has been mentioned, but now we were seeing that in NICU units, if the fetus has been delivered less than 1 kg also surviving. So this is the relation. We have to interpret our science according to the days which were going on now. So this is about. So this is the diet and exercises we have to say, and the diet. This is part of the diet. And the World Health Organization is also insisting us to have a diet schedule for a pregnant woman, for a lactating woman, for a menstrual girl, for a menopausal woman, like that we have. So here we have to increase because she is eating 2 idli in the morning breakfast. So she says, doctor, this is my ideology. I had my breakfast only 2 idli. Now we have to explain that, dear, you are not one-hearted. You are not two-hearted. You are three-hearted. You are not Dauphrudi. You are Teenfrudi. So you have to give nourishment to your babies. Means you have to give good food. So have food more times in different minimized intervals. So that can give her strength. So this is the implementation of her diet schedule to her. So we have to add everything to which is necessary for her in terms of minerals, vitamins as the nutrients, vitamins and the minerals, protein, carbohydrates, fats. Ultimately, these are the 5 we can have in the amino acids. Okay. So this is right. And exercise, don't make her to be seated because we may scared. Oh my God, she is weighing a lot, and if she walks, she may fallen down. She may have something. She may be something. She may be something like that. They may scare. So we have to advise. You can do the exercise. A minimal walk you can do. You can do whatever exercise you want to do. Everything we can counsel that woman so that she will have her normals. So this is the exercises we can advise. And luckily, the month of June we are going to have yoga day. So the yoga also is advisable. So the yoga under a training of yoga or physiotherapy under the training of a physiotherapist is very advisable to every pregnant woman during their antenatal checkups. And coming to the counseling for delivery and lactation. So the delivery and lactation you have to advise. So we know already we know the types of presentation. We know one vertex presentation when one transverse line. Obviously, we plan for her abdominal delivery. So like that, by knowing her presentations in the second trimester earlier, we can advise that the mode of delivery. So we can elect what type of delivery. If she has both vertex presentations, we can allow her into the normal vaginal delivery. If there is card around the neck, or there may be a chance of partial placenta previa, or there may be a chance of card collapse or dystocia of the shoulder, like we can see. So suddenly we may not skip her into a maternal distress, maternal distress, or it may lead into the fetal distress. There may be a loss. So that we have to advise that woman, counsel the pregnant woman and the family people about her delivery, how she can have. Definitely we try for normal delivery. All the favorable conditions are there. Otherwise, there are no favorable conditions for the normal delivery. So we are going to have an abdominal delivery. So like that, we have to counsel them from entry of third trimester only. So this is very essential for an every obstetrician. The upcoming doctors, be soft and be ease while you discuss with your pregnant woman. And lactation, you have to advise that because she may be scared. How can I share my lactation to those 2 babies or those 3 babies like that? So you have to advise. You advise them that have the normal diet and increase nutrient values. Definitely, you will give a good food, and with that we can have supplementations for lactation. That we can have the supplementation and supplementation of the nutrients. So of course, we are giving supplementation of nutrients in terms of iron, calcium, folic acid, and some of the B complex. The government of India is asking in antenatal checkup. So every woman must have 180 iron tablets. This is Indian standards. When you goes to UK or USA, so where I heard, and so many of my patients, those took infertility treatment from me, was staying there. What they say is, doctor, they are not giving any iron tablets. When I come to Andhra Pradesh, so you people like to give my mother saying that, are you having iron tablets? So that is not necessary. When she is maintaining more than 12 grams of iron, so no need of giving any iron tablets. So this is how we have to, only thing we have to give calcium tablets or calcium. That's what our Ayurveda is giving. Shira Yukta Grita, Paisa Yukta Grita, Yavana, Kshira, these all are giving for the sake of calcium, for the development of the fetus, not to have any abnormalities. So, of course, you can advise your patients, your people of pregnancy, that if you have any lacuna, you can supplement. And one thing we never forget, that we can give folic acid tablets or in terms of diet in the first trimester of pregnancy for the development of the brain matter or the notochord, and in the last trimester for the placental sufficiency. So these are the common things. And one more thing we never skip to forget, that don't forget vaccination. So you have to give vaccination for the tetanus. So we advise that lady tetanus toxoid for 3rd month and 4th month, or whatever the government regimen is changing. So just 2 years back, they're giving only 2 injections in 3rd month and 4th month. And 10 years back, they have given 2 injections during 6th month and 7th month. And before that, they're given 3 injections. Like that, the government is changing according to the World Health Organization, whatever it is giving, its ideology. So what I give according to my ideology or my observation is, whatever the tetanus toxoid we are giving in the attainments of the injections, this lasts for 6 months. So if you give 1 injection at the 3rd month, this lasts for 6 months. That means 3 plus 6, 9 months. So after 9 months, you cannot have control over tetanus. So we have to give 6 months. So here also there you may not have. Shreyas, is it okay? I'm lacking time. Hello.
No problem, madam. You can continue.
Because you gave me 40 minutes, but I'm lagging. So here the vaccination, if it is the 5th month, if it is you are giving 4th month, you 4 plus 6, 10 months. If she delivered within 40 weeks, definitely she may have. If she processed 40 weeks, definitely she may have the chance of tetany. So that the government again log into, she have to given injection tetanus toxoid at the 3rd month and at the 4.5 months, and she is advised again for the 8th or 9th month. This is why, because they are asking whatever acharyas has been mentioned in Sutika Paricharya or Sutika. Who is called Sutika? Who is called Sutika is, the Sutika is called up to 45 days by one acharya, and up to 6 months by one acharya, and up to the stoppage of lactation by one acharya. So this is how you can wait for upcoming 6 months, so that she may not have chance of tetany. So one more thing, we see the Sanakila. So this is the common factor. We can see the common disease we can see in the postnatal woman as a man. Sanakila, she is not ingesting any diamond or any raw or any situation. So the carbonized, that means there may be an abnormality which can turn into a carbonized that can make her into the mastitis. So that was another topic. One of our doctor will deal with that. So that it is better to vaccinate according to the government orders or the World Health Organization recommendations during 3rd, 4th, and 8th or 9th month for security of her pregnancy, not even for perperial period also. This I like to suggest always for the vaccination. And while you're managing, so here we have to go for the management again. So the management here we have to go for the viewing of counseling. So here I'm not saying any delivery till now. I think my teachers or my guru-like people or the doctors of more than my age, the most experienced madam or teachers were watching me. I haven't mentioned anything about the delivery. Just I'm saying the delivery. Here, what I thought is, the no Ayurveda doctor said or no Acharya said use these medicines during delivery, because the pregnant woman along with her well-wishers have to go into Sutikagara. She have to stay there till she gets Prajayani or delivery. And after some days, after Sutika, she have to come out with the children, whatever she has been awarded. So this is Sutika Gara. So that's why pregnancy is a physiological phenomena. Delivery is or labor is a physiological phenomena. But now in these days, we were not following this. But we have to accept our science, but we have to follow the government's strict instructions. So we planned that woman for normal delivery or abdominal delivery. So what complications we can see during her delivery? There may be a chance of IUGR. So during pregnancy, there may be a chance of IUGR or IUD or preterm deliveries. This all we can see. And there may be a maternal distress or maternal inconvenience. And the fetal during labor, there may be a cord prolapse if it is going to the normal delivery. And the most worst situation is the hemorrhage and shock. So this we have to skip. And after these are the during labor, and we have to take if it is abdominal delivery or normal delivery, we have to take the remote immediate or remote complications we have to read. So the immediate complications where we can see is the hemorrhage, and remote complications where you can see hemorrhage and sepsis in the immediate, and remote complications you can see is the sepsis or the tear of the vaginal sutures or the abdominal sutures, and she may go into thrombotic lesions, so that she may go into paralysis of particular structures. And the peripheral care, the peripheral sepsis is the common thing, and the women, those who have been in long period of maternal distress during her delivery as an vaginal, so she may go into distress, and she may go into lethargy, and she may not capable to give the lactation. So this all we have to advise the conditions. So only one thing is caring. Always we have to care a multiple pregnant woman than the singleton pregnancy, because she brood. And one more thing, the peripheral care here, the involution of the uterus. There may be a subinvolution because of that large growing of the uterine myometrium. So it have to be involute immediately after the removal of the placenta. So if the sometimes because of the burning of the uterus, there may be lacuna to involute. So it may lead her into the subinvolution, and automatically she might go into hemorrhage. So this all, the hemorrhage may lead her into loss of the life. So these all are a little prior conditions where we have to appropriately given priority. So every aspect you have to be careful, because we were dealing with the lives, not with the tools. So I advise every upcoming doctor to be strict towards the patients or towards the pregnant woman, those who comes to you for your consultation, for the happy progeny and the happy nation surrounding us. So this is how I like to give in terms of Bahwapatyata, and Bahwapatyata in terms of Bahwapatyata or Emalagarbha or multiple pregnancy. And one more is, I like to congratulate Dr. Shreyas and the team of Jignasa of Karnataka, and where we can have good interaction always. So here I like to conclude this.
Facebook
Pregnancy. Here I like to conclude my session as that's why you can see I'm not having conclusion between my management and my thanks, because it is not a concluded area. We should have a long progeny. The nations have to be get generations and generations and generations. Here we can't conclude. That may be a singleton pregnancy. That may be a singleton pregnancy, or that may be a twin pregnancy. But that may be a quadruplet pregnancy or triplet pregnancy or more than that. Here the conclusion is, I want every mother happy with her baby in her lap or babies in her lap through our observations. So that I thank you all, though the participants of this program, and especially the Karnataka team of Gnana Jignasa for inviting me for this webinar. And I thank Principal Sir for this invitation and inauguration of second webinar session of Gnana Jignasa Karnataka team. And I thank you, everyone. Thank you all. Thank you, Shreyas.
Thank you, madam. Thank you so much.
So I
Yeah.
remove PPT?
Yes, yes, you can stop sharing.
Yeah.
Yes. Yeah, madam. Thank you so much. It was an excellent presentation. We learned so many things from you. Like the first thing what all the postgraduate scholars have to know that is not to term a pregnant lady as a patient because it is a physiological process. So it is a pregnant woman, not a patient for us. First one.
Yes.
Second one is educating the patient about the type of twin what they have. Either it could be a monozygotic, dizygotic, MCMA, DCDA, anything. Educating the patient about her physiology, what has happened there, and the present type of the twin. And for the doctors, for the obstetricians to know what is the type of presentation where normal delivery can happen or could be managed normally, which are those type of presentations where we could manage. And also you told that this multiple pregnancy is nothing new, like it was there since ancient days, age old days. In
Yes.
fact, we also know that our Ayurveda Pravartaras and whole Ayurveda, that is Ashwini Kumaras, were also twins, to state that. Then
Yeah.
in fact, when Mahabharata you quoted about 101 pregnancies, there there in fact Kunti also had got this boon from Ashwini Kumaras and had Nakula Sahadeva.
No, that was different aspect. Only here we have to stop. One at one we have to stop.
Okay, fine. And what about Lava Kusha, madam? They had normal delivery, I think, no?
I don't know. I don't want to go. I don't want to go. They are twin pregnancy. They are our topic. Now they are our topic of twin pregnancy.
Yes. Yeah. And we had few questions, madam. Yeah. Questions from Dr. Meghana Chatre. Any chance of having multiple pregnancy in subsequent pregnancies after having twin in the primary gravida?
In
any chance of having multiple pregnancy in subsequent pregnancies after having twins in the first pregnancy, a primary gravida if she had?
Yes, of course. So usually that's why I said, if it is hereditary, so maternal factors influence a lot. If they have maternal hereditary factors of multiple pregnancies, definitely there may be a chance of multiple pregnancy, even the first of primary gravida, rather than our iatrogenic. We people, what our obstetrician will do, the induction of ovum. So that definitely even the primary gravidas. I have so many of my patients, those took infertility treatment at our clinics. They have so many people with multiple pregnancy, twin pregnancies in their primary gravida. Yes, it can be. Yes, they may have excessive rates.
Okay. Another question from Dr. Shweta Singh. Ma'am, anywhere in Samhita, it's mentioned about expect weeks for delivery.
Yeah, it is there. Suppose you go in Garbha Vignana. You go in the Garbha Vignana. So there they will say expecting date of delivery is not there. When she enters into Navama Masa and Dasama Masa, they have to prepare Sutika Gara and she have to go into this Sutika Gara. She can wait up to Ekadasha Dvadasha Masa and she can get the delivery. So that means you have to expect that she has the pregnancy of 8th month or 9th month or 10th month or 11th month or 12th month that can get into the delivery. Why our acharyas has been mentioned that 8th month, 9th month, 9th month, 10th month, 11th month, 12th month means they may have irregular cycles. She may be conceived, but she may not have an idea that she may have a prolonged cycles. Somewhere she was ovulated. When she comes to the OP, she says, "Doctor, I had my LMP on 1st January, but she had ovulation during mid of the March. So there she had 8 weeks. So she can carry her pregnancy for 42 weeks to 44 weeks. There is nothing defect. And sometimes they may have shortened ovulatory cycles. So she may have the shortened ovulatory cycles of 24 days menstrual cycle. So there she can have a delivery prior in 9th month or 10th month. this is the common. So this is knowing EDD, knowing the time of delivery or onset of labor, according to our classics, is clearly mentioned in Charaka Sharira and Susuka Sharira. They just once you refer, definitely you will get the answer in Garbha Sharira.
Yes. Thank you, madam. Another question from Dr. Priyanka Teva. How to understand Shukra Artava Bahulya concept in modern?
Pardon? I didn't hear. Pardon, repeat, Sri.
How to
Yeah,
how to understand how to understand Shukra Artava Bahulya in modern concept.
There are some sections here it is better not to touch. No make controversial. Okay. So when you say that
exactly.
they never accept. So don't compare. Sometimes comparison may not work. Okay. That first we have to learn. And after that, Shukra Artava Bahulya means there is more ovum, you know. That's why I said in the superfetation, there are 2 ovums. They have fertilized in different kinds of intercourse. This is called Adhika Artava. And this is what we can say, Adhika Artava and Adhika Shukra. There we can have the chance of getting more than one pregnancy in different ways. So this one thing we can say that, and apart from that, better not to have any controversial relations in our science while comparing with the allopathic science.
Yes. Yeah. Another question from
I think this is my opinion. Someone may accept or not.
Okay. Okay. Yeah. Another question from Dr. Shagufta Sheikh. Ma'am, what Ayurvedic drug can we prescribe as an alternative of progesterone support in modern medicine?
Progesterone support. So here we have to give the foods, whatever, but you are mentioning the drugs as progesterone means here we have some drugs like Alarson company. They're the leptidine. They're the ingredients which are pro-factors for progesterone. And you can search Garbhafal Ras. So this is also having more factors of increasing progesterone levels so that we can give a little bit of G to this progesterone without adding progesterone drugs in allopathic science.
Okay, madam. And we'll take the last question from Dr. Sujata Gonu, madam. So, scope of Ayurvedic management in present scenario.
The Ayurvedic management in present scenario.
Yeah.
So, why we have to think about Ayurvedic management? There is no disease. Pregnancy is not a disease. That's why they said Garbhini Parcharya. Masanumasika Parcharya have to be followed for management in pregnant women. This I strictly insist because it is not a disease. So you have to give Garbhini Parcharya for singleton pregnancy. It is Daupudi. And one more thing we have to adopt means you have to accept Daupudi Achara. You have to give respect to Daupudi demands. That's why you see simple we travel along with any places. So sometimes we were traveling along with any pregnant women. Sometimes we may eat fruits or sometimes we may eat cakes or something. Definitely we offer that woman. This will happen in around the globe, I think. Definitely in our India. Why? Because what we know is just Abhimanyu is watching from her mother's womb what the father is saying. The same thing. Her baby is watching us. What the other people are eating, her that mother was not eating. So definitely she may have some itcha. If Daupudi has not satisfied her itcha, there may be a lacuna of delivery or there may be a lacuna of fetal growth. So these all are mentioned in our classics in Kashyap. So you have to fulfill the demands of Daupudi, whatever she demands, but not to get a moon from heaven or from universe into the lap is not possible. So it's not like that. Okay. So there is no management for pregnancy in our Ayurvedic classics. If you want to read, there you can read Garbhini Chaddi, Garbhini Pandu, and all we have the diseases. So there we can meet the managements. Though it may be Bahwapatyata. I think this is my view. Okay. I'm not hearing.
Yeah. I've not started. In fact, there's a slight disturbance. 1 minute, ma'am.
Okay, no problem.
Yeah. Okay. There was another question from Dr. Madhuri Balgat. So, madam asked, is it possible whether the lady is having bicornuate uterus and she may get.
Hello.
Hello,
Yes.
madam. Yeah. Is it possible the lady is having bicornuate uterus? Is it possible?
Maybe the superfetation we can expect. Maybe the superfetation we can expect. Or usually there may be a chance. There may be a chance of a single formation of pregnancy can be seen, unless until if she have superfetation, she have different cycles with different ova. There may be a chance in each corner of the uteri.
Okay, madam. Yeah. And the last question for today from Dr. Kajal, postgraduate scholar of Rajiv Gandhi Education Society, RON. So she asks, she says that, ma'am, is cervical encerclage necessary for all twin pregnancies?
No, not at all. Not at all. Cervical encerclage is not at all advised to every twin pregnancy. If so, there are so many twin pregnancies will happen, but it is nothing there. Very rare cases where we observe cervical incompetence with the history of previous abortions, recurrent abortions. Then you have to advise that woman to be rest apart and have the encerclage of the cervix. This is essential to secure her pregnancy. But every pregnancy or every multiple pregnancy does not need cervical encerclage. It is only the skill of that particular obstetrician. She have to or he have to make a decision that that pregnant woman will have safe pregnancy, for safe delivery and safe baby.
Probably we have to start training our postgraduates through our Kashyapi to make them more confident in practicing obstetrics of Ayurveda. Has to start now, and we'll have to make them confident enough to try to manage it, courage to manage all such cases. Yeah, thank you, madam. Thank you so much for enlightening about the rare concept, the untouched, that is Bahwapatyata, and Rajiv Gandhi Education Society's Ayurvedic Medical College, RON, and Jignasa, Karnataka. Thank you wholeheartedly for enlightening our postgraduate scholars today, madam. Thank you so much.
Practice makes man perfect. So this
yes, madam. Yes.
Read. I always insist every doctor, not only the obstetrician or a gynecologist. I insist every doctor, read till you can serve. So that was my instruction to everyone, to myself, to yourself, and to our medical fraternity, so that we can help everyone. And thank you very much, Shreyas. This is a good opportunity to meet all of our doctors throughout India or around. So all the best to you for your future. Thank you.
All the postgraduate scholars got to know that it is read. So always read. So tomorrow we will be meeting with another session. Tomorrow's session will be again Garbhini Vyapat. We're dealing about Garbhini Jwara. We have a renowned speaker, Gujarat. So from Gujarat, Dr. Ashokan sir will be addressing you all with the unique or important Garbhini Jwara. So till then, and do watch or do catch us tomorrow at 7 p.m. live through Jignasa. Have a very good night, all of you.
Thank you all. Good night.